In the last video, I introduced you to methods to preserve milk. We discussed pasteurization, sterilization, and ultra-high temperature treatment. Now let's see the consequences of heat treatment. If we are subjecting our milk to high temperature treatment, it may result in production of a few desirable components and a few undesirable components. So first, let's discuss what are the desirable components that are produced. Lactose, which is called as milk sugar, is made out of galactose and glucose. It undergoes something called as isomerization reaction to yield lactulose. So this is the first and foremost desirable product produced during high temperature treatment of milk. It is used to differentiate between heat treatment methods. Okay, this lactulose is found to be high in sterilized milk. Why? Because of prolonged exposure of milk to a temperature of 120 degrees Celsius for 15 to 30 minutes, followed by UHT-treated milk. In UHT-treated milk, even though you're subjecting the product to high temperatures for fraction of a second, the temperature that is used augments the speed of isomerization reaction, resulting in production of lactulose. And finally, you have pasteurized milk, which has minute quantities of lactulose present in it. It is used in treatment of constipation as it is a natural laxative which is capable of absorbing water, thereby making stool very soft. It is also used in infant formula as it is used to promote growth of gut microflora in the gut of the infants. So sometimes this can be available as a generic medicine in few of the countries, and if it is not available as generic medicine, it is often used as a food additive by the manufacturers. Now, moving on to the undesirable components that are produced during high temperature treatment. First, let's see in sterilized milk what happens. In sterilized milk, we have something called as non-enzymatic browning, okay, as a result of Maillard reaction and caramelization. In fact, it is Maillard reaction which is more common in milk because we are subjecting it to a temperature of 120 degrees Celsius or at the maximum 150 degrees Celsius. If you want caramelization to occur, the temperature should be beyond 160 to 180 degrees Celsius. Now, both these reactions, they are capable of contributing to brown color formation in milk. It may not be well perceived by consumers when you consume milk, although it might be acceptable in bakery products like bread. What you have to remember here is that it is these reactions, that is Maillard reaction and caramelization, that provide bakery products its characteristic aroma and flavor. Second, UHT-treated milk. In case of UHT-treated milk, you're subjecting milk to temperatures of 150 degrees Celsius for a fraction of a second. So UHT-treated milk will have some heat-resistant enzymes like proteinases, lipases, phospholipases present in it, okay, which are capable of causing chemical spoilage like rancidity, gelation of UHT-treated milk. I don't know if you've experienced this, but I have experienced this. If you have UHT-treated milk, okay, you open the UHT-treated milk, you place it in fridge for, let's say, 3 days. After 3 days, there is gel formation at the bottom of the Tetra Pak, okay. Also, I've seen that if you keep the UHT-treated milk beyond the shelf life of the milk, there is formation of gel at room temperature. These enzymes, they are also capable of changing taste and texture during the shelf life of milk. For phospholipases, for instance, it can cause production of bitter peptides in your milk. Thank you for staying with me through the video. In the next video, I'll be discussing how milk is preserved in countries where refrigeration is considered a luxury. Until then, merci beaucoup.